All right, respiratory. Hi, my name is Amy and I'm a respiratory care student with the respiratory care department. And I see in your charts that you're needing an oxygen tank. So here I have an oxygen tank here. So before I begin, I'm always gonna make sure my hands are clean. I'd always wash my hands, dry them, and then also check the patient's ID band. And always before you give them any oxygen, you always want to get their pre-vital signs. So I got their vital signs and everything for that. All right, here we have an oxygen tank. So the way you can tell it's an oxygen tank, it's green, and it also shows on the label that it's oxygen. So here you can see it's oxygen. So you're gonna hear a little loud noise every time I bring in an oxygen tank, I have to crack the cylinder. So here we have an E-cylinder and I'm gonna crack it, and it's just gonna be a loud noise just real quick, and then it's gonna be off. It's just that way no particles are in the opening, that way we don't get anything into their device that they're gonna have. So I crack the cylinder, and then I'm gonna get the regulator that they have here. All right, so here I have a pin index safety system regulator, and the way you can tell, you have the pins here. You can always check the pins, and then you always need to check the washer in the back, the O-ring there. That is way, make sure it's not cracked, anything like that, so that way it has a tight seal on the cylinder and it's not going to cause any leaking. So when placing this on, you want to place it in the appropriate pin area here. And make sure always it's tight. And then you'll begin to open up the cylinder to make sure it is flowing properly into the regulator. And so here we have, this is how much it's showing, is 1,000. So with that, since it's an E-cylinder, you take the 1,000 times 0.28 and divide that by the liter flow. So today, your doctor has prescribed a nasal cannula. So I'm gonna get that set up. I will take it out of its bag. And he wants you to be at 2 liters per minute, okay? So I'd set it at 2 liters per minute. Then I'd also make sure I feel a flow at the bottom there. And that way there's no obstruction inside the, and there. So then I'll hook it up here like this. And then before I place it onto the patient, I'll make sure I feel a little air coming out, that way when I put it on to the patient. And when they are done, then I would take and roll this up a little bit so that way it's not, doesn't fall to the floor. So I'd shut off this, I'd remove it from there. Then I can place it on there just for now, and then I would shut it off, make sure it's off. And then I would shut off this tank, make sure it's completely sealed, and then I will turn the regulator back on, that way it empties back to 0. It'll go back to 0 there. And then you always shut off the regulator before you remove it. Then you'd remove it like that. Now for the patient, all right, so with this oxygen tank, you don't want anything covering the top of the regulator up here, because it can cause combustion. And with that, it may not be flammable, but it can cause a fire very quickly if it combusts, okay? You don't want any kids playing around and knocking it over. It always needs to stay in its safety cart at all times. And we'll set it next to your bedside to where nobody should be able to touch it or move it, okay? And on the outside of your door, I placed a no smoking sign, so that way any visitors that come to see you, they know that they cannot smoke around you or around the oxygen tank, okay? And so once I have given them an oxygen treatment, I always need to get their post-vital signs to see how they're doing on their oxygen. And then I would chart that I placed them on an O2 tank, an E-cylinder, and that I placed them on a nasal cannula at 2 liters per minute. And also, if you notice that your regulator gets down to 500, we need to just let us know and we'll get the tank changed out for you.